stop it. And another very inefficient way of stopping something is to make quitting aids illegal if you're trying to get people to quit smoking. And this has just been blown out of the water on the front page of the Sydney Morning Herald this morning, where it turns out that the federal government's own Australian National Advisory Council on Alcohol and Other Drugs was alarmed to find out that the government was planning not to make vapes easier to access for people trying to quit smoking, but harder, and to require them to have a prescription or nothing at all. Well, someone who is probably going to be saying, I told you so, to quite a few people today is someone who has been of immense benefit to me and helped me get a prescription so I could stay off the smokes and be around for my kids. So I'm eternally grateful for that. He is part of the Australian Tobacco Harm Reduction Association. His name is Dr. Colin Mendelsohn. He's an expert in quitting smoking, has been for decades, and he joins me on the line right now. Colin, welcome to Afternoons. How are you?
I'm very well, Joe. Good afternoon.
Good afternoon to you. You must have, I'm not sure what your response would have been when you picked up the paper this morning and saw this article that basically confirms what you and others in this area have been saying for years.
Well, exactly. This is no surprise to us. We sent a letter to the Health Minister from 44 leading tobacco control and addiction specialists about a month ago, saying just this to him. And we haven't received a reply from that. But we also warned the Minister 3 years ago when it was Mr Hunt that exactly what's happened now with the vaping ban would eventuate. And now Mark Butler is planning on doubling down further in his plan to ban vaping. And it's just a slow train wreck. And we can see what's going to happen. And we're pleased to see that other experts are coming out in favour of liberalising this approach.
How is it possible that the minister was able to go against the advice of his own expert advisory body? I mean, the health minister is not a doctor himself, as far as I'm aware, so especially in that portfolio, I imagine, more than any other, you would rely on the advice of your agencies and your experts.
Yeah.
How has he been able to simply dismiss this? Is it because there is a very different sort of evangelical approach being taken by the Therapeutic Goods Administration?
Yes, look, the problem for the minister, in all fairness, is that he's under enormous pressure. So most of the anti-smoking organisations in Australia, tobacco control, take a very abstinence-only approach. So they say, well, people should just quit smoking and that's it. A bit like the war on drugs, you just stop. Yeah. But of course, that doesn't work for many people. And they take this view that vaping isn't necessary. People should just quit, and therefore we don't need vaping. And unfortunately, he's getting very bad advice because that approach just isn't working. And Australia's smoking rates have levelled out over the last 4 years. The most recent figures showed they haven't changed for 4 years. And we need safer alternatives for people who just can't quit, which is working so well in other countries.
This is the other thing I don't get. I mean, Australia is always looking to other countries in the West or the Anglosphere, like comparable countries, such as, for example, New Zealand, Canada, the US, Europe and the UK. And pretty much all of them, certainly the UK, EU, Canada, and New Zealand, I mean, they actually promote vaping as a quitting aid, do they not?
Exactly. Like in New Zealand and the UK, governments say to smokers, if you can't quit with traditional methods, and most people can't, that's the reality, then consider switching to vaping. I mean, the whole purpose is to stop people dying from smoking. And if you keep smoking, which most people unfortunately continue to do, 2 out of 3 will die from smoking. And vaping's not risk-free, but it's far safer than smoking. And Australia is very much an outlier. You know, all those other countries you mentioned take a very different approach where vaping products are available legally as adult consumer products, so you can go to a licensed retail outlet and buy them, where access to kids is restricted. So adults who want to make that switch can readily access these products. In Australia, it's much easier to buy deadly cigarettes from the corner store than it is to get vaping products. Yeah, and that makes no sense.
That's the one thing I can't get my head around. And thank you. You actually corrected a statistic I mentioned earlier. I said that from memory that among smokers, a third of them will die from smoking-related illnesses. It's in fact 2/3. It's a third who don't.
Up to 2 in 3.
Yeah, there you go.
Generally accepted figure. Yeah, for long-term smoke.
So it's it's twice as bad as I said, which was which
Yeah.
is already extremely bad. And this, you make an important point here. No one is talking about making vaping more accessible or legal for kids. Obviously, you don't want kids to start. You just want to make it easy for people who are smokers to be able to switch to vaping with as little of a barrier in the way as few hurdles to jump over as possible.
Exactly. And the way the current regulation works, only 8% of smokers actually have a prescription. So 92% of smokers buy them from the black market. So this has led to a thriving black market, which sells huge volumes of cheap imported Chinese disposables, which are not regulated. They're dodgy products. They're sold from black market outlets, supplied by criminal gangs, and they're sold freely to young people. So, in fact, we're not protecting young people at the moment by this method. We're actually making it more accessible for young people.
Well, that's right. If it's illegal to sell to an adult and illegal to sell to a young person, there's no incentive to restrict access to young people. Whereas if, like cigarettes, you said, right, it's legal if you're over 18, but banned if you're below 18. It's the exact same protocols that exist for alcohol and tobacco already. Exactly.
Well, we're just suggesting 73% of Australians support selling these products just like cigarettes. So available for adults who choose to use them, but restricted from young people. And that's what the licensed, regulated model would allow. But this idea of people having to go to a doctor for a prescription for a vaping product it's just not working, and people are refusing to do it. Well, and the black market stepped in to take over.
And I suppose again, it's not necessarily you want to make. For me, anyway, it was something. You know what? I'll give this a try. It wasn't like I woke up one morning and said, "Right, today's the first day of the rest of my life. I'm going to make an appointment with my doctor, if indeed I can get one that day," which you probably can't. So you better hope that you still feel that way in a week's time or whatever when you get a doctor. Then you got to hope that your GP actually knows how to prescribe it. Because I had a friend of mine who was a smoker. I was trying to get him to stop smoking. Went to his GP and asked for his prescription, so I was legit. And his GP said, "I don't even know how to do this. I would not even know how to prescribe it." And then again, of course,
GPs have no idea, and they're also encouraged not to prescribe. I mean, the AMA and the Heart Foundation are all saying, "Well, we're not sure about this vaping. Don't do it." So the GPs are very sceptical. It's very hard to find a GP. Less than 1% of GPs will write these products because of all the negative messaging and because of the medico-legal risks to them. So the current model's not working for lots of reasons, and there are very few pharmacists that supply them, and smokers have said, "Oh, this is just too hard."
And also, it would cost money unless you can find a GP that bulk bills, which is increasingly hard. It's going to cost you. You're going to be paying someone for something that really you want to be doing for as little as possible, for as little money. I mean, we should be incentivizing smokers to quit, not charging them for the privilege.
Exactly. It should be cheaper to get these products, and it is if you buy them under normal, without this medical model. It's much cheaper to buy them, and people are more likely to access them if it's cheaper and easier. And we should be making it as easy and attractive and accessible as possible for adults. So, because vaping is the most effective quitting aid we have, Joe, as you know, and it's also the most popular. So we want people to do it, adults to do it. We don't want kids to do it. And if we regulate it like they do in New Zealand and the UK, we can restrict it from kids. But look, having said that, the risk to kids is greatly exaggerated. And this article talks about the moral panic about kids.
Yes.
Whereas the risk to kids is not nearly what we're constantly reading about in the media. It's most vaping by kids who've never smoked is just experimental. They do it for a while, then they stop. And overall, it's reducing smoking rates in kids. So it's not such a big concern. Yeah. We don't want kids doing it.
No, that's right. Of course not. But
it's actually having an overall positive effect. Very few are becoming nicotine dependent. The health effects are relatively small. So to drive the policy based on that is a mistake, I think.
Yeah. Look, I couldn't agree more. And again, I just know I'm not a doctor, you are, and you're an expert in this field, but I just know from myself and all the people around me who are all smokers, and virtually all of them have now stopped because they now vape instead. But Dr. Colin Mendelsohn, thank you very much for joining us. I could talk all day, but we have to get to some other things.